Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started. Hi there. The following is a message sponsored by AbbVie. As we all know, rheumatic diseases like RA are not always physically apparent. For some patients, their disease journey may include having to try several options to manage their condition. It can feel like there is no hope in finding something that may work for you. That is why I'm so excited to tell you about Room for Dialogue from AbbVie. It's an initiative designed to empower us to address these emotions and feelings with our doctors, because being open and honest with your rheumatologist can help you find a care plan that is appropriate for you. If you're living with a rheumatic disease and feel like your care plan isn't working for you, it's time to talk to your doctor. Visit roomfordialogue.com to learn more. That's roomfordialogue.com, spelled RHEUMFORDIALOGUE.com. Let's turn now to the podcast episode.
Welcome to Rheumer Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease.
Through plain language interviews with experts, we offer actual knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl.
Join us as we bust myths and spotlight evidence. Now, today we are very excited to have somebody that we saw speak at the most recent American College of Rheumatology conference in Chicago. She went to two of his sessions, and I got to go to one. And they were on exercise. And we knew right away that we had to invite Dr. Andonian here because we were just absolutely floored with the information that he shared and also how he shared it. We're really, really excited to have you here. And Cheryl is going to talk a little bit more about what we're going to go on with next.
Yeah, you had these presentations that really talked about in so much depth, in scientific depth, the science behind how nutrition helps with rheumatoid arthritis and other inflammatory forms of arthritis and how exercise helps. Can you just let the listeners know a little bit about your presentations? And I guess we also say like your background, like what do you do? Who are you?
Well, thanks for having me. I can start off by giving some background about myself. I'm a rheumatologist and a physician scientist at Duke, and the focus of both my practice and research is in lifestyle medicine. And so lifestyle medicine to me encompasses 6 key pillars. Exercise is one, diet is another, but also stress management, social connections, and sleep, as well as substance use. But my background really is in athletic training and exercise science. That's how really I got into this field. And I was asked at ACR to give 2 different talks. One was based on my research looking on how exercise helps our patients with rheumatic disease. And then the other talk was linking the biology of aging to rheumatic disease and how healthy lifestyle might combat aging and arthritis as a next step from there.
That's great. And yeah, I the one that you did on the aging, I it was an aha moment for me because I had heard that people with rheumatoid arthritis have a lower lifespan, but I thought it was kind of like, okay, towards the end. I didn't realize it was actually throughout the lifespan we're aging faster. So me as a 44-year-old, I thought, okay, I'm aging normally, and then like at the end it just all of a sudden goes bad. So
Mhm.
anyway, that was my aha moment. But today we really want to go over some specific myths and facts about exercise and strength training and how these things actually work because unfortunately there are a lot of myths out there. So the first myth is that people with arthritis are just too fragile to exercise or exercise is going to cause more quote unquote wear and tear. What would you say to that?
Oh, this is a great place to start a discussion on exercise because this myth has really been around for decades. I would say patients still have concerns that their arthritis is a limiting factor and that exercise could further damage their joints. But we know that the evidence is really the opposite, and there's growing evidence that exercise is really beneficial for arthritis, and that's across the board, whether we're talking about osteoarthritis or rheumatoid arthritis or spondyloarthritis. And there was a recent publication from the American College of Rheumatology really highlighting integrative interventions for patients with rheumatoid arthritis. So I think we can apply it to all of our patients, at least as far as how we know what we know at the moment. And that's that all our patients really should be engaging in exercise. So exercise is a key component of the care of patients with rheumatic disease. The problem is, unfortunately, there's more work that needs to be done in this area because the guidelines couldn't give more specifics on the timing or the type of exercise, like aerobic exercise versus resistance training exercise. But it doesn't mean that we shouldn't still prescribe exercise and still recommend exercise, but it's just that we're learning more all the time.
Yeah, can you give a little more detail about those components? I used to always think exercise meant cardio, like you had to be running or doing something where you're really breathing heavy, but I neglected strength training for a long time and to my detriment. So can you explain some of those core pillars of exercise?
Right. I think most patients and most of us just in general, when I say exercise, think of aerobic exercise, which is a key component. That's your walking or biking or swimming, things that get your heart rate and breathing rate up. But as you mentioned, another key component is strength and resistance training. And this is trying to build muscle or to get stronger muscles. And this can be going to the gym and using machines or using weights, or for our studies in patients with rheumatoid arthritis, using resistance bands we found is really effective way to get stronger and build muscle. And then there's other components to exercise that have to be worked in. And I group this under the idea of mobility exercise. So things that work on balance and flexibility, and that can incorporate like mind body exercise, like yoga and Tai Chi. So there's a lot of different areas that we need to hit when we're talking about exercise and physical activity programs.
Yeah, I love it. And one more follow-up question I have on that is how does strength training or exercise slow down that accelerated aging phenomenon or make us not age as fast?
Well, I love that question. I think one key component is what we're learning is the effect of exercise on inflammation. And we know that inflammation, even this low level of inflammation, is really tied to aging in general and diseases related to aging. So patients who have rheumatic disease or inflammatory diseases, we know well how inflammation impacts them. But also just any disease in aging is really linked to inflammation. So there's growing evidence showing that exercise can improve disease activity in multiple of our diseases. For example, rheumatoid arthritis. So actually improves how many joints are swollen, how many tender joints we have, as well as these inflammatory markers that we check in the clinic, things like sedimentation rate and C-reactive protein. What I'm really fascinated is how we actually can get to improved inflammation. And our research and others would suggest that exercise really improves the way our immune system functions. So it's not just that exercise is purely anti-inflammatory, but it actually just helps our immune system function better depending on the situation, which to me is really the holy grail in rheumatology is figuring out how to get our immune system just to work the way it's supposed to, not attack itself, not put us at risk for infections. But there's a lot of things we don't really know yet. We've shown some links between our fitness, so how fit we are. We measure that by something called VO2 max testing. We've found that our immune system changes, like the metabolism of our immune cells, are actually linked to our VO2, our fitness. So there seems to be something about how exercise can impact the immune system on the cellular level to really make improvements. But we have a long way to go. But I think it's exciting to know that exercise is not just good for our heart and lungs, it's good for our immune system and then also our joints as well.
That explanation was really helpful. Thank you. And I know that leads actually perfectly into Eileen's next one.
So obviously, one of the biggest myths with arthritis is that it is only a joint disease. And with exercise, there might be the myth that it doesn't help anything else but the joints. How would you kind of bust that myth?
Hi there. The following is a message sponsored by AbbVie. As we all know, rheumatic diseases like RA are not always physically apparent. For some patients, their disease journey may include having to try several options to manage their condition. It can feel like there is no hope in finding something that may work for you. That is why I'm so excited to tell you about Room for Dialogue from AbbVie. It's an initiative designed to empower us to address these emotions and feelings with our doctors, because being open and honest with your rheumatologist can help you find a care plan that is appropriate for you. If you're living with a rheumatic disease and feel like your care plan isn't working for you, it's time to talk to your doctor. Visit roomfordialogue.com to learn more. That's roomfordialogue.com, spelled RHEUMFORDIALOGUE.com. Let's turn now to the podcast episode.
Yeah, it's a great one too. The first point is really key, that especially talking about inflammatory rheumatic diseases, and we'll use rheumatoid arthritis as an example. It's really a disease of the immune system, although it affects the joints. So it's really, I think the joints are a secondary problem. The example I give is that we see immune system changes in patients who go on to develop rheumatoid arthritis 10 and even 20 years before the actual diagnosis. So these antibodies we check for rheumatoid arthritis, like a rheumatoid factor or a CCP antibody, we see those many years before you actually get arthritis. So this is one reason I would say that if exercise is helping our patients, it's really targeting the immune system.
You just said that the joints are a secondary problem.
Mhm.
Can you elaborate a little bit more about that and why you would say that with diseases like inflammatory arthritis, rheumatoid arthritis, that the joints are a secondary problem? What else is the problem?
Yeah, so I think rheumatoid arthritis and our other inflammatory rheumatic diseases are immune system problems. I think of lupus as being a really good example. And diseases like rheumatoid arthritis and lupus can affect the body in so many different ways, although you can get arthritis from both conditions. But for both conditions, you can get lung disease. Rheumatoid arthritis, you can get inflammation of your blood vessels. And there's a lot of different ways that inflammation can impact someone who has rheumatoid arthritis. So even though it's called rheumatoid arthritis, it really maybe is better rheumatoid disease, because it really affects the whole body. And inflammation, we know, is affecting the whole body. So that's a really good question.
Yeah, I've heard that a lot from people, that they would prefer it to be called rheumatoid disease, because arthritis is only a small fraction of what really we are going through. So thank you. Cheryl, would you like to ask the next
Yeah.
question?
Yeah, and almost all of us have a period of a few years before our diagnosis where it was like, something's off in my body. I'm not sure what. So yeah, if we had better screening tools, anyway, then we could maybe be able to catch those early.
For sure.
Yeah.
The pre-RA, as we call them. Yeah, we're really trying to understand that group of people before they actually get full-blown disease.
Yeah, but the next myth is that this is kind of going more to, okay, I bought in now. I know that exercise is important. The myth is that there's just one standardized exercise plan that works for everyone, and that it's just found online. We just need to go online and find you go on YouTube. Like, what can you help break down? Is it a one size fit all situation or not?
Well, this gets at a lot of really key points here. As we talked about, exercise includes multiple different types: aerobic, resistance training, mobility exercise, all going together. But then there's a lot of exercise programs, as you mentioned. You can go online and find a lot of exercise programs, but there's not a lot of tailoring to the specific problems that our patients with rheumatic disease have. One of my goals and others who are interested in this space is how do we really prescribe exercise for the given individual? Because depending on where you have arthritis, for example, it can affect my approach to what I recommend. The easiest example, or maybe the most clear example, is for my patients who have osteoarthritis, or really, I guess, really any arthritis that's affecting the lower body. Think of the knees and the hips and even the spine. We think of walking as a really good form of exercise for people. But for my patients who have that lower extremity or spine arthritis, walking can be really hard and actually a lot of stress, and it can be very difficult to walk to get your aerobic exercise because I think the impact can be too great for a lot of patients. So the recommendation probably should be, even though walking is good, maybe we can work towards walking by doing other things. That is offloading our joints through maybe cycling on a bike or elliptical machine or anything in the water is really going to be ideal. So getting in the pool and swimming or doing pool exercise. So there needs to be a little more guidance than we currently have. Just you can look online for exercise. So I think as we as a medical community and just society needs to appreciate the benefits here, and hopefully we can develop better programs for the individual.
Yeah. And as an occupational therapist, of course, I can't avoid bringing up that patients can ask for referral to a physical therapist or occupational therapist. I know mileage may vary, but if you could ask your local OT or PT clinic, do you have anyone there that has real experience with inflammatory arthritis? That can be a good place to start if you want that kind of hands-on help. And the other thing that I know in one of your, you went into a lot of detail, and that I think some people are scared or nervous sometimes about like high impact exercise. What did you find on like high impact exercises in spondyloarthritis?
Yeah, this goes back to that tailoring question. I think every form of arthritis has unique needs. We talked about osteoarthritis as maybe we need to modify activities to a certain extent, but spondyloarthritis is probably one of the most unique forms of arthritis, and maybe exercise should be approached a little differently. It's unique in a lot of ways because spondyloarthritis tends to affect younger men more than anyone else versus really all the other kinds of arthritis, including osteoarthritis and rheumatoid arthritis, tend to affect women much more than men. And the other component is the areas where spondyloarthritis affects people. One key area is the sacroiliac joint, and this is the joint that connects the spine into our pelvis and hips, and really undergoes the highest amounts of load and stress of any joint in the body. And the idea that that's one of the key areas of impact in the disease. Among other reasons, we think that biomechanical loading and stress on the joints actually contributes to the arthritis and triggers the inflammation that people get. We know that exercise is really good for these patients. So it's not that we shouldn't exercise, but maybe we should be avoiding really high impact type exercise. I think of Olympic style weightlifting or really heavy ballistic exercise that involves a lot of heavy running and jumping. Maybe that's not the appropriate focus for exercise, though I have patients who do all of that and do it really well without any problem. Probably more about how you're building slowly to that type of program and not over stressing the joints, because that can potentially trigger inflammation in spondyloarthritis.
That's really helpful. Thank you. I know Eileen has another one.
Often when people live with inflammatory arthritis, I hear a lot that fatigue is the most debilitating symptom, and sometimes over pain. A lot of the times, I know myself, when I'm really fatigued, I think I need to just listen to my body and I need to just rest. Exercise is just going to make me feel worse and make things worse. Is this true?
It's a tough question, I would say, because it is good to have intuition and listen to your body. And often our body is telling us what we need. And it's often tricky to connect fatigue with the cause of fatigue because inflammation in our body can cause fatigue. And we know that reducing activities can be good for certain kinds of inflammation. When I say certain kinds, it's generally acute inflammation or just a new inflammation, say you have an infection. Our body sends us signals to be less active to try to conserve energy for our immune system to take care of that infection. And there's probably a lot of benefit for that in that situation. The problem is when you have that inflammation that persists and persists over time, it's kind of this dysregulated pathway, or your body's really giving you this signal when it shouldn't necessarily be doing it over time, if that makes sense. So then your body is moving against what its natural instincts are. And our patients with arthritis in general, I find, have kinesiophobia, which is this idea of fear of moving that will make things worse. But exercise can really help with fatigue too. So just finding that balance. We have a lot of studies, and our work would suggest that exercise really improves fatigue. And an interesting finding that I like to talk about is that fatigue improves with exercise, but we're finding that fatigue improvements were highly associated with improvements in our fitness, and also some findings that fatigue actually improves along the lines of mitochondrial function in our body. So there's actually a connection between the fitness in our cells and the fatigue that we're experiencing. And exercise might be a way to actually help with that. It's just a matter of, you should still listen to your body, but really slowly try to build and try to improve your fitness over time. And that can actually do the reverse of what your body's trying to tell you. So I think it's where we need all our OTs and PTs and everybody who's working with our patients to know that there's a lot of benefit from exercise, not just from arthritis, but from other symptoms that our patients experience.
For those that are struggling with their fatigue for either inflammation reasons, or maybe they're also struggling with their mental health, do you have any words that you would maybe suggest for them to get started?
Yeah, I think progressing slowly is really the name of the game. People think about exercise and maybe they think of this perfect program where to reach the guidelines, you're getting 150 minutes of moderate intensity aerobic exercise. For someone who's really fatigued, inflamed, and hurting, that can feel like a very daunting task. However, we know that exercise, even in little bits and at a time, it can be really helpful. It all adds up. So when you change the mindset to, it doesn't have to be this perfect program. It doesn't have to be that you're getting exercise for 30 or 45 minutes. It can just be a couple minutes here and there, and it can be spaced out throughout the day. Even if it's just getting up from your chair more times throughout the day, maybe trying to take the stairs one more time than you were planning to. Little things like that can add up. So it doesn't have to be this daunting task of getting that recommendation. You still want to build over time, but the hardest part is just getting started. And if you think about this is really slow progress that you're supposed to make, it really can help make things easier and more manageable.
There's one saying that I've heard quite often: exercise is medicine. Why would you say that's important for people living with arthritis?
Yeah, the exercise is medicine is really referring to the idea that exercise has so many beneficial effects on the body and really can be similar to our pills that give us the benefit to actually help with the problems we have. I mentioned earlier about we think about exercise improving our heart and our lung function. But if we think about exercise not just as a heart or lung therapy, it's actually helping our joints, it's helping our immune system. And if we can learn specifically about each disease that a patient would have, then we really can tailor the program. And it really becomes, this program actually helps your problem, not just exercise is good for you, you should do it. I think that's the messaging that people often hear. But I found that when you really personalize it, it can help you in this specific way. It really becomes powerful and truly becomes a medicine. So that's our goal. And my goal as a lifestyle medicine practitioner to get people to know that exercise and healthy lifestyle are more than just things that you're told you should do. But a lot of physicians and other providers don't put a lot of emphasis on it as we should.
I actually have one more rumor that I've heard of kind of around that. Does exercise help make our medications work better?
Oh, I love that question. A lot of things we need to learn, certainly in the field of patients with rheumatic disease. But I would say we've seen from our studies and from a lot of patients that exercise can help us maybe need less medication over time. Maybe we can have less reliance on medication. And that would be another reason exercise and healthy lifestyle actually can potentially reduce the need for medications. If living healthfully is a way to get there, that can be good motivation.
Yeah, 100%. So that is what I've been trying to do with really
Yeah.
bumping up my strength training over the last couple years, which I know I told you at the conference. I was like, this is magical. I don't even understand how it's working so well. I think it's a vicious positive cycle of it's improving my sleep, which is improving my fatigue, which is improving my mental health, which is improving it's so far beyond just my joints. I mean, the joints feeling better is like super secondary to me. It's really that quality of life. So anyway, we're getting to the conclusion part of this episode, but before we get there, I want to make sure everyone knows we're going to have a lot of links in the show notes to what we've been talking about for people who want to learn more. But in one sentence, what is the most important takeaway you would like someone to take from this episode?
This is tough. A lot of good take-home points, but I think just the idea that exercise is really critically important for helping managing arthritis of any kind, and it really should be integrated to any program. And as I mentioned, there should be kind of a slow progression. Just getting out there and doing any little bit will help you get to that point. And that exercise program really should include not just aerobic training, but also strength and resistance training, which I love that you brought up again. I think there's so much that strength training can help. Just building stronger muscles can help in so many ways, as you mentioned, including our immune function too, but also including balance and mobility exercise to have a well-rounded program.
Mm-hmm. I love it. This is so helpful. Thank you. I know Eileen has one quick other question.
So finding reliable resources on exercising with inflammatory arthritis can be a challenge. There's lots of fitness influencers and websites out there that are going to be recommending exercises that are not good if you have joint pain. Do you have any resources that you would recommend for our listeners?
Yeah, this is a huge area of need. So I think we have some videos that we developed as part of one of our research studies for patients with rheumatoid arthritis, looking at aerobic and resistance training videos. And there's a couple ways you could find that. I do think that the UNC Prevail website, a couple of colleagues of mine just down the road from Duke have developed a really good compendium of exercise and has videos and a lot of recommendations, is a really good place to start. And I'll put a plug in for a group that we newly formed of academic rheumatologists. So we formed this group called the Calm Room, or the Coalition to Advance Integrative and Lifestyle Medicine and Rheumatology. We're working on building a website that will hopefully have all these resources, at least that we currently have, in one place in terms of diet and exercise and stress management and sleep. So that's it. It's in progress. So I'll have to update you when we complete that, because there's a big need, and there's a lot of people, as you mentioned, talking about the best exercise and lifestyle programs, but I think we need the evidence behind the programs before we can fully recommend it. And that's what our group is trying to do, to show the evidence and then give those resources to our patients.
Absolutely. As a patient partner with Arthritis Research Canada, I know how important those resources are, incredible resources, and it's really exciting to know that you are also creating some of those, and I can't wait to hear about that one.
Great.
So again, thank you
that.
so much for coming here today and being on the podcast with us. Like I said, both me and Cheryl, when we saw you speak at ACR this year, we just knew we had to have you on here. You explain why exercise is so important for so many factors, not just our joints, but because RA and inflammatory arthritis is a systemic disease. So it helps so many different parts of our mind and body. And again, thank you so much for being here today.
Thanks so much for having me. I really enjoyed it.
Yeah, thank you. And just to all the listeners, don't forget to check out the full show notes on the Arthritis Life website, and you'll see a transcript there as if you like to read rather than listening. And there's also a YouTube link to this interview. So thanks so much again, and we'll sign off for now. Bye-bye. Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease. In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group. of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.